Hello and welcome. India has reported 41,322 fresh COVID-19 cases till today. That's 4% lower than on Friday, taking India's total number to 93,51,000 cases and a total of 1,36,200 deaths. These numbers come even as a vaccine to fight back the virus seems tantalizingly close. The states of Maharashtra, Karnataka, Andhra Pradesh, Tamil Nadu and Kerala are the most affected, with deaths ranging from 23 to 85 in the last 24 hours. And in the context of these numbers, what do we need to do to protect ourselves and our loved ones? To keep us up to date on everything we need to know about the fight against the coronavirus is Dr. Randeep Guleria. He's the director of the All India Institute of Medical Sciences, also an author now, co-author of Till We Win, India's fight against the COVID-19 pandemic. Thank you so much, Dr. Guleria, as usual, for your time. We know you're extremely busy. I want to quickly get down to the top story of the day, of course, was Prime Minister Modi visiting those 3 vaccine development sites in Ahmedabad, Hyderabad and Pune. This week, the PM held discussions with states and union territories on vaccine distribution. The Serum Institute this evening said that they're going to apply in 2 weeks. 2 weeks. So they've advanced that deadline for the emergency use of the coronavirus vaccine, the one that's developed by the Oxford vaccine. That's what Adar Poonawalla said. There is increasing COVID fatigue, as we can see from the rising number of cases. So where do we stand in getting a vaccine and one that is accessible to all Indians?
So I think we are now very close to a vaccine, and the Prime Minister himself has now visited the various manufacturing sites, and that is a big push and a big encouragement for the vaccine manufacturers. The important issue here is, of course, that we have to look at 2 things. One is to get the data in as far as the vaccine that are being undergoing clinical trials in India, whether it be Covaxin, Covishield or the Russian vaccine Sputnik, to see that they are safe in our population and that they have efficacy that is acceptable as far as the vaccines are concerned. Once we're able to do that and the regulators are able to give the approval for the vaccine, then we have another mammoth task on hand, and that is to have a good supply chain, trained manpower, and to be able to have sites which can vaccinate the wide and diverse population that India is all about. So whether it be metropolitan city, smaller towns, or even rural India, how do we really make the vaccine reach to all these areas? How do we maintain the cold chain? How do we train the healthcare workers to vaccinate individuals not once but twice, and also make sure that they're able to explain to them whatever side effects that can happen with the vaccine and how they should follow them up to see for any subsequent long-term side effects. So it's a huge challenge, and already a lot of work is being done on this, but this is going to be as big a challenge as getting the vaccine manufactured, the manufacturing of the vaccine is concerned.
So that's just the first step. But you know, on Wednesday, AstraZeneca acknowledged a key mistake in their vaccine dosage received by some study participants, right? Now, this added to questions about whether the vaccines, this apparent spectacular efficacy will hold up under additional testing. What were your main takeaways from the AstraZeneca acknowledgement of its error? What questions does this raise about the vaccine and trials in general?
So it has 2 ways of looking at it. The first way is that what AstraZeneca said, that this was a blessing in disguise, because they found that in around 2,700 individuals who were vaccinated with half the dose first and the full dose later on, they had a higher efficacy than the group that got both full doses in the first part and the second part. They're still trying to explain this scientifically. It seems that they're trying to say that's more related to the immune system getting tuned in and then having a booster effect.
Okay.
But I think the bigger question is that how could a trial be done where they made this major mistake in such a large number of individuals of giving half a dose in the beginning and then the full dose later on. So that raises question on the quality of the trial in various parts of the country where it's being done. This is a multi-site trial which is being done in many countries. But to have a large number of individuals get half the dose in the beginning raises a lot of question in terms of monitoring and the other issues, that how closely were the safety part of the vaccine also monitored. So I think those are very, very important issues, because it puts a question mark on the quality of the trial.
Wow. So no, is that because we're in a rush? We're obviously racing against time. This has already been 1 year. Talks about vaccine coming in 2021, maybe even 2022. And so is that the concern here? Shortcuts?
So I think, so even if you you know what, this is something that we've said repeatedly, that when you're looking at a vaccine, the very important part of a vaccine is that it should be safe. You cannot have shortcuts on safety and efficacy. You may do things in parallel, and that is where one was able to decrease the time that usually takes for vaccine development, that you were able to do phase 1, phase 2, and then phase 3 in parallel, and you could start manufacturing also at the same time, rather than doing it in sequence, that you did phase 1, you analyzed the data, then you went on to phase 2, analyzed the data, then you went to phase 3, then you got regulatory approvals, and then you started sort of manufacturing the vaccine. Here, everything is being done in parallel to cut short the time, but that does not mean that you should have any shortcuts in terms of monitoring for safety and for efficacy is concerned. If that is done, then that raises a lot of questions. And when we're now talking of giving vaccine to healthy individuals and to a large number of people, we must be very confident that all the protocols were in place in terms of safety and efficacy.
So you're raising some crucial red flags. So is there then a cause of concern for the Indian trials also? Does this raise questions for India's Covishield, which is based on the AZD 1222?
I don't think so. In India, the trial was conducted and both the full doses were given in the beginning and in the second part. So what we need to do is look at the Indian data also, and I think the regulators will look at it more closely now, both in terms of safety and efficacy. And I'm sure the regulators in UK, where they will also apply for emergency use authorization, will look at it. And it's possible that in the other parts of the world, the trial may get extended a little bit to really get a hang of this part of the data that they have sort of discovered.
Dr. Guleria, you said, you mentioned in the in your first answer that efficacy is acceptable. So, you know, this leads me to ask, and I think this is a question many a layperson may be wondering about. You read so much about vaccine efficacy, 95% efficacy, but you can give it to less than 50% of people, or 60% efficacy, but you can give it to 90% of people who should be getting it, so it can have the same or better effect. So the man on the street will be wondering, does a vaccine not have to have 100% efficacy to work? And does it only work? Many questions. Does it only work if everyone has it? Is it like polio? How does one make this trade-off? Higher efficacy but poor people, lower efficacy but more people protected?
So it's dependent. The first thing to remember is many vaccines are don't have an efficacy of 100%.
Okay.
Even the flu shot that we give every year, the maximum efficacy is only 70 to 80%. So the issue here is, what are we trying to achieve by the vaccine, by giving the vaccine? Our aim is basically two. One is to decrease the mortality. So if we are able to say that it gives good efficacy and effectiveness in the high risk group, that is those who have a higher chance of dying because of COVID-19, then we can say that this will actually be protective, and you may get exposure, but you will get a mild disease, you will not get a severe disease, and giving it to the high risk group will actually decrease the mortality. You may not have to give it to a large number of population if you're trying to decrease mortality. But here our aim is also to decrease the pandemic, to decrease the number of cases that we're getting, even if they're mild cases. And therefore, you will have to, even if you have a vaccine where the efficacy is low, but you give it to a large number of people, then you can break the chain of spread of the infection among the population, and thereby decrease the number of people who will get the infection, and thereby get the cases down. It not be zero, you will still continue to have small outbreaks of COVID-19 cases, but life will come back more or less to normal if you are able to do that.
So that is why then, Kate O'Brien, the director of the immunization, vaccines and biologicals at the WHO, had said on Friday that, the troublesome storage conditions of some candidate coronavirus vaccines and the associated high costs should not discourage countries from adopting them as an immunization means, and that countries may that the approach countries may take is to choose to use vaccines that require an ultra cold chain only for certain portions of the population. So that would be the former, the example you're giving in the beginning, if you want to keep the death rate down.
Exactly. And let's also accept the fact that even if we have one vaccine, it's not going to be able to supply the entire vaccine demand for the entire world. So you will have to have multiple vaccines which may be available. And like we've said before, we need more data to say which vaccine is more effective in which group of ethnic variant group, or which high risk group, in the elderly, in younger age group, in people with comorbidities. And even if we have vaccines which are equally effective, if we have more than one vaccine, it will be easier to have a larger dose available to vaccinate more and more people, and thereby decrease the number of cases and the spread of the infection.
Which is why then, if AstraZeneca's error is correct, then it is a blessing in disguise, because then you'll only need half a dosage, so there's more doses to go around. But
yes,
Dr. Guleria, as India enters this decisive phase of the fight against COVID-19, as you said at the start of the show, on the 24th of November, the Prime Minister spoke with chief ministers of various states over the deteriorating pandemic situation in their states. He advised states to establish cold storage facilities for COVID-19 vaccines beforehand. You've touched upon this in your first response. Is that going to be the next challenge? How are COVID vaccines to be stored? Does India have the infrastructure to store these leading candidates from Pfizer, BioNTech, Moderna, AstraZeneca? Because, I mean, did you hear of numbers like minus 18 degrees Celsius, minus 94, the Russian Sputnik vaccine, minus 18?
So I think it's very important what you've asked, and therefore it's important to look at it from 2 points of view. Any vaccine that we look at in India at a large scale has to meet the practical issues of being able to be distributed to the entire country. Or we will have to look at a differential policy that in larger cities where it's possible to store at a lower temperature, we allow those vaccines to be used there. And in smaller towns where you will have a vaccine which needs to storage it, let's say in 2 to 8 degrees centigrade, like Covaxin, or the Covishield, we allow then those vaccines to be used there. That is the Serum Institute vaccine and Bharat Biotech vaccine. Remember, India itself has a very good immunization program as far as children is concerned.
Polio.
We've managed to, we have a very good national program, Indradhanush, and also have had a very successful pulse polio program. But the challenge is that that was for children, which was a smaller population. Now we're talking of the entire population of the country, or at least a large majority. And therefore, whatever cold chain facility we have, which already exists as far as immunization in children is concerned, that needs to be upscaled to sort of absorb or to take up the extra doses for the adult vaccination. So that is what needs to be done. And I think that is what is being referred to, that the cold chain process is existing. And we also need to develop a mechanism which could be using digital technology to see that the chain is maintained, the temperature, there is no break in the cold chain, and we know how many doses are available in each storage area, how many are needed, how they can be given to different sites on a particular day, so that that population in that area can be successfully vaccinated.
But going by your answer, doctor, then would I be too forward to then say that, given that, in reality, practically, seems unlikely that everyone can get vaccinated until maybe 2022. It sounds like it's not going to happen. We're hearing January deadlines, March deadlines.
Correct. So what will happen is there is a priority that the government has made, and it will depend on the number of doses and the number of manufacturers which get the authorization or the regulatory approval for the vaccine. And that has to be matched. How many doses are available, and what is our priority list, and how many people are on that list. For example, you could say that if there are healthcare workers that have to be vaccinated, what is the number? Is it 1 crore, 1.5, 2 crore? So we need that many vaccines upfront. If we go on to frontline workers, what is the number? If we go on to the elderly, what is the number in our country which is more than 60? Do we have those doses? Then the second important issue is, how do we reach out to all of these people to vaccinate them in a very systematic manner? and how do we develop a strategy so that it can be done with the vaccine being distributed at that point in time. This is going to be a long drawn process. I think it will take a few months to do it. And once we reach that stage, and I'm hopeful that by March and April, we will have regulatory approvals from many other companies which are making vaccine. It could be the Russian vaccine. It could be the other vaccines which are being tried. And therefore, the numbers will become much more. And we really don't know how the pandemic will behave in the next 6 months. So keeping that in mind, one is hopeful that by the middle of next year, we should have a sufficiently good number of doses, and maybe the number that we need to vaccinate may also come down.
All right. So let me get some other questions that people have sent in, viewers have sent in. So if that happens, as you're saying, by next year, will we still need to wear a mask even after we get a vaccine? How long will we have to go on wearing masks?
So I think we'll have to keep wearing a mask for probably next year also. And in my mind, in many ways, wearing a mask is not a bad thing. It prevents you from other respiratory viruses, whether it be influenza, tuberculosis. And we all know that even in the winter months in northern India, when we have air pollution, the mask is also protective against particulate matter. And it does protect you as far as exposure to air pollution is concerned. So it's something that may be needed for a long time.
So masks are here to stay. Another question, Dr. We hear so many of these, it's anecdotal, but you hear of these cases, you read on these WhatsApp messages of somebody who recovered from COVID and then was exercising a month or 2 months later. And, there's been tragic cases of deaths reported. What exactly is there a formula, is there a prescription when it comes to post-COVID return to exercise or just return to normalcy? Because now we're at a stage where we have 93 lakh people who've had COVID in the country.
So I think we're learning more and more of post-COVID sequelae, and this is an important issue that we know that some people who recover and become all right suddenly deteriorate, and some of them have a sudden death, and it's related to multiple factors. And that is why at the time of discharge, it's important to reassess the individual. If there is a higher risk that this person may still have what we call a prothrombotic stage, there is a higher chance of clotting. And this happens in individuals for various factors, maybe their overweight, the swelling of their feet, they were not moving that much, and the clot was formed in the leg veins. And then you started exercising aggressively, and that clot got dislodged from the leg veins and reached your lungs and caused what we call a massive pulmonary embolism, and that could lead to sudden death. So it's important that people realize that they have to be careful because there are significant post-COVID sequelae, and they must sort of follow their doctor's advice. And some of them should be very careful that if they have a high risk of developing clots, then they should take a blood thinner for at least 3 months till such time that the chances become less and less.
And any other advice? Because again, initially the shows we did with you, we talked about how one should prevent catching COVID. We asked you for advice on that. Now with 93 lakh cases in the country, what advice would you give? Basic, simple advice to these 93 lakh and others who are contracting it as we speak.
So 2 or 3 very important things. One is that don't be over enthusiastic in starting very rigorous exercise. We have what is known as chronic fatigue syndrome. There is weakness, joint pains, backache, and we've seen patients who've gone back and to a very rigorous exercise program and really had literally a breakdown and severe return of their body aches. So don't really be very aggressive in exercising. Have a good diet with green leafy vegetables, fresh fruit. Do that. If you have any other symptoms, you must consult your doctors, because some people do continue to have numbness of the hand or feet, or sometimes failure to concentrate, what is we call brain fog, or a chronic fatigue syndrome. So there are a fraction of individuals which we now feel are significant as we starting having more and more recovered individuals who will need some long-term rehabilitation, long-term care and long-term treatment for almost 4 to 8 weeks, sometimes 12 weeks after having recovered from COVID. The other important thing that I'd just like to highlight is that even if you recover from COVID, continue to follow the infection control practices that we keep advising. Remember that you would not want that you recover from COVID, but because of your immunity being low, you catch another infection. It could be a bacterial infection or another viral infection, which really puts you again down and back into the hospital. So your preventive measures in terms of protecting yourself from infection should even continue after recovering from COVID.
Vitamin C, vitamin D, the zinc, all of those tablets continue with them.
Supplement you must take, yes.
All right. Lastly, Dr. Guleria, you know, Till We Win, your book, is a story of how no country was fully prepared for this pandemic. Yet, you say India pulled together despite all the odds. We are successfully tackling this pandemic. That said, what are the lessons to be learned from this pandemic so we don't make the same mistakes? The same mistakes aren't repeated. Shortage of ICUs, PPE suits at the beginning. What should India learn from this?
There's a lot of learning that we've had. One is that we have to be self-reliant, especially in the health sector. When we started, we didn't have PPEs. All of them were being imported. We didn't have N95 masks. There was shortage of ventilators. And also, although we've had outbreaks of infections almost for 15 years, from SARS to H5N1 to the swine flu to outbreaks of Zika, we never have really invested aggressively in an outbreak management plan, which we need to do. How do we upscale our infrastructure, our health resources, our health manpower if there is an outbreak? We need to really work on that so that next time if there is a pandemic, we are better prepared. We also need to invest a lot as far as public health care is concerned, especially preventive health, and also work a lot on surveillance so that we can pick up any outbreak, which may be even regional, at an early stage and try and prevent it from spreading and becoming an epidemic or a pandemic much before it happens.
All right, Doctor, that is the note to end on. Thank you so much. As usual, speaking with you is so invigorating. Thank you for your time.
Thank you very much. Thank you.